Good morning, everyone. My name is Susanti. I'm taking master program in biomedical science at Atmajaya Catholic University of Indonesia. My research is focused on anti-aging and also nutraceutical science. Let me begin my presentation. My study titled Effects of Green Tea Kombucha on Adipose Oxidative Stress and Serum Adipokines in D-Galactose-Induced Aging Rats. Good. Population aging is a growing global challenge that increases the risk of cardiometabolic diseases. This process is largely driven by adipose tissue dysfunction and adipokine imbalance, characterized by reduced adiponectin levels and increased leptin resistance during aging. These alterations are closely linked to insulin resistance, cardiovascular disease, and frailty. Green tea kombucha, a fermented beverage with antioxidant and anti-inflammatory potential, may help modulate these aging-related changes. Although green tea kombucha has recognized antioxidant and anti-inflammatory properties, its role in modulating adipose oxidative stress and adiponectin leptin balance in a D-galactose-induced aging model remains unclear. We conducted an 8-week study starting with 30 Sprague Dolly rats, of which 26 completed the full protocol. We used D-Galactose to induce aging in all groups except for the same control. Our in-house green tea kombucha was administered at 2 doses, 5 and 10 ml per kilogram body weight, and compared against standard green tea. Finally, we analyzed blood to measure adiponectin and leptin levels, and adipose tissue to measure oxidative stress markers. For the result, as shown in Table 1, our in-house kombucha has an acidic pH of 3.2, high antioxidant activity, and contains beneficial lactic acid bacteria and yeast. Moving to Figure 1, the galactose significantly increased MDL levels, a marker for oxidative stress, in the aging group compared to the sham group. And green tea kombucha, particularly the high dose, significantly reduced these MDL levels in the adipose tissue. In Figure 2, we observed that high-dose kombucha helped restore reduced glutathione antioxidant levels that were depleted by the aging process. Similarly, Figure 3 shows that both doses of our kombucha significantly improved catalase enzyme activity compared to the untreated aging group. As seen in Figure 4 and 5, no statistically significant differences were detected among any of the groups for serum adiponectin or leptin levels. Finally, Figure 6 shows that while the sham and positive control groups experienced significant weight gain, the groups treated with kombucha and green tea maintained more stable body weights throughout the study. Based on our results, our in-house kombucha fermented for 10 days demonstrated an ideal profile for experimental intervention. Oxidative aging and adipose tissue was successfully induced through 8 weeks of D-Galactose administration at a dose of 300 mg per kilogram body weight, evidenced by a significant spike in MDL levels and decrease in antioxidant levels. Green tea kombucha treatment markedly reduced adipose tissue lipid peroxidation by 46.3% and 64.2% at doses of 5 and 10 ml per kilogram body weight, respectively, indicating significant protection against oxidative stress in adipocytes. This antioxidant effect was primarily mediated by direct free radical scavenging, with partial modulation but limited restoration of endogenous antioxidant defense system. Green tea kombucha reduced lipid peroxidation in a dose-related manner, while glutathione showed a non-significant improvement at higher doses, suggesting a possible plateau effect. Catalase activity was greater at lower doses, indicating a potential hormetic response. Serum adiponectin and leptin levels did not differ significantly between groups, although leptin tended to be lower in kombucha-treated rats. Stable body weight across groups suggests preserved metabolic homeostasis, which may have limited detectable systemic adipokine changes. Overall, green tea kombucha reduces oxidative damage in aging adipose tissue mainly by lowering lipid peroxidation. The D-Galactose model likely represents early and localized redox changes rather than clear systemic endocrine disruption, which may explain the minimal differences observed in circulating adiponectin and leptin levels. This result suggests that green tea kombucha is more relevant for early redox modulation in adipose tissue. Further studies should extend D-galactose induction or use naturally aged models, assess adipokines at tissue levels, evaluate broader dose ranges of kombucha and green tea, and include markers of adipose inflammation and tissue morphology. That concludes my presentation, and thank you for your attention.